Right, here's Pharm review part 5. I'll get into sex hormone here. So female sex hormone is estrogen. Estradiol would be the most potent one. And then you have estrone, which is more in the menopausal woman. That's another form of estrogen. And the synthetic form is ethinyl estradiol and mestranol. And the synthetic form tend to have longer duration of action and more potent in a way. Selective estrogen receptor modulator are known as SORM. So in this case, it can work on the estrogen receptor. Sometimes it works as an agonist, sometimes it works as an antagonist. That's why it's called modulator, depending on the tissue of the receptor. Clomiphene is usually used to stimulate ovulation. Raloxifene is usually used actually for patients with osteoporosis and maybe breast cancer. It can be for both. Tamoxifen tend to be for more patients with risk of having breast cancer or having breast cancer. Tamoxifen, one thing to keep in mind is that it can also cause retinal toxicity by accumulation of tamoxifen, similar like the Plaquenil. Progestogen, so this is progesterone kind of related, so they tend to be more used in combination with estrogen in oral contraceptive. As you can see, norethindrone is commonly used, norgestrel also used with the estrogen in terms of oral contraceptive. Androgen, danazol, which is a mild androgen, and it's actually used to treat treat endometriosis and fibrotic breast tissue. Testosterone, so that is the active form of male hormone. And then you have anti-androgen. Anti-androgen can work on two mechanisms. One is can work on the testosterone receptor, and another is can work by inhibit the 5-alpha type of reductase, so that inhibit the synthesis of testosterone. So those with the steroid suffix is more inhibiting the 5-alpha reductase, whereas those have the thymide suffix will act as an androgen or testosterone receptor antagonist. This is an ovulation cycle. So usually initially you have luteinizing hormone stimulating more of release of the estrogen. So estradiol phase will come first, and then when the menstrual ovulation starting, you start to have progesterone kind of release with the FSH in that order. And for estrogen side effect, those tend to be headache, weight gain, change in libido. Anti-inflammatory effect of NSAID. Usually NSAID have 3 effects anti-inflammatory, and anti-inflammatory tend to use at a higher dosage, and antipyretic, which is working against fever, and analgesic having helping with pain. Antiplatelet tend to be more just for the aspirin because it irreversibly inhibit cyclooxygenase. COX-2 inhibitor, celecoxib and rofecoxib. Celecoxib is Celebrex, so that's probably the only one around right now. So COX-2 inhibitor is better because it can inhibit the specific form of COX that is the inducible form and more related to inflammation, whereas COX-1 actually is constitutively present, and you don't want to inhibit COX-1 because it actually produces the prostaglandin and help to protect the lining of the stomach. Half-life of platelets is about 5 to 7 days, so if you use aspirin, it irreversibly inhibit the COX, so it will last about 7 days, the life of the platelet. Aspirin, remember, not to be used in children with fever or with viral symptoms because it can cause Reye syndrome. Reye syndrome, you need to keep in mind, it can cause like brain swelling, brain inflammation and also liver toxicity. Children with fever treatment, usually you use acetaminophen or Tylenol. In terms of close patent ductus arteriosus, is you use indomethacin. If you want to keep it open, then you use misoprostol or prostaglandin analog. NSAID can induce renal failure because it inhibits the production of prostaglandin, as you can see there, E2 and I2. Those help to maintain the flow to the kidney. Non-selective NSAID, you have ibuprofen, naproxen, diclofenac, indomethacin, ketorolac, proxicam. So those were CCAM drugs are more of the long-acting one, and the diclofenac and ketorolac, so they have the ACT there, available in topical medication as well, like the Voltaren or the Acala. Antidote to Tylenol overdose, I said already, this is mucomyst and acetylcysteine. Okay, here are the breakdowns. So take a pause and look at some of the property of the different members of the NSAID. And as I can say, oxycam, as I mentioned already, have kind of longer duration of action, whereas some of them actually more irritation to the GI tract than other. And COX-2, now you only have celecoxib because the other one, beficosib, is already withdrawn, the Vioxx, because they have cardiovascular incidents. Miscellaneous here, miscellaneous is fat-soluble vitamin, I already mentioned DIG, immunosuppressant, cyclosporin A in the restasis, tacrolimus as a thioprine, mycophenolate, so those are immunosuppressant. Tacrolimus, sometimes it's available in cream in case you have like more of contact dermatitis situation whereby you don't want to use a steroid. You can use tacrolimus or sirolimus. Osteoporosis, this is a bisphosphonate class of drug, the dronate, and some form actually available. You can do injection every 3 months, and there's actually a form reclass, that's the brand name, can be actually yearly type injection. So Bonivar is the one that is for 3 months injection, and a reclass is the one for the whole once a year. Raloxifene, it's a selective estrogen receptor modulator, but used in osteoporosis as well. Erectile dysfunction, sildenafil, tadalafil, and vardenafil. So tadalafil is the Cialis, the one that can have up to 36-hour duration of action. The advantage in this case is that the patient do not need to force the activity and have more time to plan for the sexual intercourse. Viagra side effect, you have headache, dizziness, color change, hypotension, and Viagra cannot be mixed with the nitrates, right? Nitroglycerin for angina. Rheumatoid arthritis treatment, glucocorticoid, infliximab, methotrexate, hydroxychloroquine, that's a Plaquenil thing. Penicillamine is actually a chelator used to help to chelate copper in Wilson's disease, and that's the one that you can have Kaiser-Fleischer ring copper buildup. Gout treatment, you have allopurinol or Febusostat. Febusostat is a new xanthine oxidase inhibitor. Another one is probenecid, which work in increase the secretion of uric acid. So that's why you call uric agent, will increase the secretion of uric acid. Colchicine work in different mechanism. It's by inhibiting the microtubule assembly, so it can preventing the white blood cell from migrating to the site of uric acid buildup. So that way it helps to prevent inflammation. Okay, so moving on to the topical agent. Here are topical corticosteroid, and Durezol right now is the most potent form, but Forte would be the next up. And then all these steroids, in a sense, they are more of on alcohol base. So whereas the only one that is ester base is the Lotamax. Ester base, the only one is Lotamax, and that's why say Lotamax is actually can be broken down by your body system, so you have a shorter type of duration of action, so have less propensity of increasing the intraocular pressure. So you have the strength in terms of the maximum strength steroid, and then you have the moderate strength in terms of FML, Alrex, and Bretmide. Alrex is the weaker form of Lotamax, and Alrex can actually be used for allergic type of conjunctivitis. For coma drug, you have epinephrine, which is not used that often anymore because earlier drug. Alpha-2 adrenergic agonist, you have abraconidine and primordiline, alpha-GAN, and basically mechanism is either increase flow or decrease production. So I have the mechanism out there, so just take a look and review them. You have beta blocker, and betaxolol is more beta 1 selective, cardio selective, so it's better for patients with asthma. Carbonic anhydrase inhibitor, you have acetazolamide, that's oral form. Then you have the Azov and Trusov in terms of benzolamide and dozolamide. So one thing to remember, for oral acetazolamide can also use for like altitude type of sickness. You use before you climb mountain, and it can actually also induce a sickle cell trait and sickle cell anemia. So need to be aware of that. Miotic drug. So here is you pull on the muscle of the iris, and that pull on the scleral spur and help to open the outflow. So miotic cholinesterase inhibitor, you have physostigmine, ecothiopate, which is the irreversible type of inhibitor of cholinesterase. It's not used often anymore. Prostaglandin, remember, it's the first choice of drugs. So you latanopros, bimaprotopros, so they increase the uveoscleral outflow, scleral outflow. Travoprost, they all have the pros right there. Uniprostone also used, and Rescula, that's the brand name. Uniprostone is actually coming back. It's just reapproved and remarketed out there for treatment of glaucoma. Combination, you have CoSOP, which combine alpha-GAN with timolol, and Combigan is a combination of CAI with timolol. Other agent, acetazolamide, oral, mannitol, and glycerin. So those are more of mannitol is more intravenous type of emergency. We want to lower pressure. Glycerin is actually an oral hyperglycemic type of agent. Allergy, you have all form of allergy, antihistamine, and mast cell stabilizer type of combination right there. Remember, you have partner, part day, Lastacraft, which is the new one, and Biprave, also another new one. And then in terms of mast cell stabilizer, you have the Chrolum, Alloquil, Alamide, so they are kind of stabilizing the mast cell. So for the mast cell stabilizer, you want to use like more of a preventive measure before the season start in terms of seasonal allergy. Topical antibiotics, different form. You have the fluoroquinolone class, like the Moxiza, Vegamax, the Zymaxid, and Besavons, which is the only kind of fluoroquinolone type of things, and probably it's less prone to a resistance issue. Aminoglycoside, tropomycin, gentamicin. Most often we tend to use tropomycin, and the general practitioner tend to use gentamicin. Polymyxin B basically is a combination of polymyxin B and trimethoprim, or polymyxin B and bacitracin. So bacitracin is more gram positive, and polymyxin B is more of a gram negative. Other new drug There you have azithromycin. It's actually used more off-label to treat anterior segment problem, ocular surface problem, like you have meibomian gland dysfunction or stye. And the theory is that it does have some anti-inflammatory effect and that it can accumulate in the lid and the conch soft tissue. Erythromycin ointment is good if you have a patient with blepharitis, overnight type of usage. Bacitracin the same way, you can use ointment overnight for blepharitis. Corticosteroid antibiotic combination, so you have a few forms, blephamide, and the most common one we use tend to be Topodex, and now there's a new version of Topodex ST because it's having less amount of dexamethasone. And also Xylet would be another one, which is combining loteprednol and topamycin, and we say loteprednol is an ester base, have a shorter effect, shorter duration of action and less effect on IOP inducing. Oral for optometry, so you have preceptor cellulitis, you use some of those dicloxycycline, azithromycin oral. Ocular rosacea, you doxycycline. Allergy, you can use Allegra. Hepatic lesion, you use acyclovir or valacyclovir. Blowout fracture, you can use Keflex or Z-Pack. For pain, you can use Lotab or Ultram. Chlamydia, azithromycin or Z-Pack. Orbital pain associated with sinusitis, you can use Z-Pack. For pseudotumor cerebri, you can use diamoxicil, so slow releasing in this case, whereas in acute angle closure, you will want to use not a sequel, but you use the immediately release, not the slow release. Ocular side effect and systemic medication drug interaction can happen with drug food and drug disease. Viagra in the eye can actually cause more of color, blue tinge type of color perception, and it can cause ischemic optic neuropathy, and it can potentiate with nitrate drugs, so nitrate is contraindicated. Orlistat can inhibit fat-soluble vitamin absorption, similar like we said the bowel sequestrant, the cholesterol. Tamoxifen prophylaxis, you need to check before the drug and check for toxicity in the lens and in the retina. Plaquenil toxicity. Accutane can cause more of increase in intracranial pressure, and tetracycline. Phenothiazine can have anticholinergic type of effect, can cause different ocular side effects, as you can see there. And anticholinergic, if you use over the counter type of antihistamine, it can cause actually dilation of pupil, dry eye. Allegra is safer than Benadryl. Anticholinergic side effect, the 3D dryness, drowsiness, dilation. Cholinergic side effect, drool, diarrhea, damp. Diuretic, lost salt and water. Thiazide and carbonic anhydrase inhibitor are sulfur. Loop is most potent, case sparing. Diuretic can be used combination with thiazide and loop. Amiodarone, verticillata, which is wall keratopathy. Tylenol and alcohol, not a good mix because it can lead to liver failure, and the maximum recommended dose is less than 4 milligram. Calcium channel blocker and vasodilator is not a good combination because can amplify the beta blocker side effect. Beta blocker indication: hypertension, angina, arrhythmia, migraine, anxiety. Serious beta blocker side effect: asthma, coronary insufficiency, depression, diabetics. Impotence. Statin and cataract. Statin may cause cataract, but it's not truly proven yet. Diabetes and NSAID, as we said, NSAID can actually decrease the blood flow to the kidney, so it may not be too good for a patient with diabetes. Drug capable of induced hemolytic anemia and glucose 6-phosphate deficiency, chloramphenicol, chloroquine, nitrofuran derivative, primaquine, sulfonamide, vitamin K, steroid side effect. There are a bunch of steroid side effects, and remember for the eye, just cataract and glaucoma. So these are the drugs that can cause fatal condition worsened by topical beta blocker. What does chloramphenicol have in common with diamox, sickle cell disease, Stevens-Johnson, sulfur allergy? Both induce aplastic anemia, both produce hypoglycemia in diabetic. Okay, this you can just read yourself. As a summary. So these are some of the summary of drugs that can affect the cornea, drug that can affect the lens, drug that can affect the conch, lid, and sclera, drug that can affect tear. So there's a lot to learn, so you need to prioritize your time and review what you need to. And the best thing is actually to do question and then come back to the area that you're weak on. And remind you, pharmacology is only about what 10 to 20% or 10 to 20%. So, but pharmacology is important because TMOD, right? For some state, you actually need to have 75% in that section. So drug that can cause myopia, drug that can cause cycloplegia, and drug that can increase IOP and may not be good for narrow angle. Drug that can affect the retinal function. So yeah, just pause the slide and look at the drug that affect the retinal function. Optic nerve, ethambutol, isoniazid, amiodarone. In terms of sort of tumor cerebri increase in intracranial pressure, you have like oral contraceptive, tetracycline. Okay, poison antidote. So here is just the agent that will neutralize the poison. So like if carbon monoxide poisoning, you use oxygen. For methanol, you use like ethanol. So here is just a vitamin deficiency and the problem that it may cause, which is for you to kind of review. Just have a pause and take a look at it. Alright, this is the slide just about the growth media for different bacteria, for different strain, microorganism, and that's it. Good luck. Best wish.